Good morning. This is All India Radio, Kohima. The morning news are read by Jonas Yantan. The NBF Legislature Party has expressed concern on the mishandling and unpreparedness of the BTA government in handling the rising COVID-19 cases in the state. In a press release, spokesperson of NBF Legislature Party, Imkong L. Limchan, stated that the government seems to have learned nothing from the first wave which all have faced last year. He said he excused that other developed nations and Indian states are also finding it difficult to contain this virus should no longer be parroted by the government as a result of its own inefficiency. The NPF Legislature Party expressed fear that people of the state will soon be faced with a huge challenge to even provide basic amenities for the COVID-19 patients, pointing out that Dimapur, having the highest number of COVID cases, has only 2 designated COVID hospitals, which is not sufficient to meet the demand for beds with uninterrupted oxygen supply for patients who require hospitalization. The NPF questioned on what could be the fate of the other district COVID hospitals, terming that total lockdown should be the last resort of the government. The NPF, looking at the indifferent attitude and alarmingly rising positive cases in Kohima and Dimapur, the only option left to protect the people would be for a total lockdown in these 2 districts. Appreciating the efforts of the central government for magnanimously sanctioning funds in the name of COVID, the NPF, however, alleged that there is still no significant improvement in the healthcare facilities in the state. It also said a vaccination drive, though not mandatory, should be immediately carried out for free as announced by the State Chief Minister. Further, the NPF, taking all seriousness of the impending third wave, which is likely to be worse than what we have experienced thus far, called upon the present dispensation to ramp up the required infrastructures in all the district-designated COVID hospitals. Sumi Hoho has urged the state government to impose complete statewide lockdown for a period of at least 10 days in order to break the chain of community spread of the COVID-19. In a representation to Chief Minister Nagaland, Sumi Hoho lauded the state machineries and all the frontline workers for their unceasing efforts to contain the spread of the pandemic. The Sumi Hoho, however, observed that COVID-19 positive cases, casualties, are surging in the state and said one cannot deny the fact that the community spread is endangering the lives of the entire state. In this, the Sumi Hoho urged the government to immediately impose complete lockdown of the state for the larger interest and safety of the citizens. Meanwhile, Kohima Village Council has also proposed an immediate total lockdown of Kohima and Dimapur. Nagaland government has prioritized the vaccination of employees in several departments and corporations of the state. The departments and corporations include banks, Nagaland State Transport, Nagaland State Rural Livelihood Mission, Liquefied Petroleum Gas, OIL, Food Corporation of India, Postal Service, journalists, and high-risk groups involved in quarantine centers. The Health Department asked the Chief Medical Officers and Medical Superintendents of all the districts to intimate the concerned corporations and departments to submit the names of the staff with employees' certificates by tomorrow. It also informed that there would be no site registration. The departments and corporations have also been asked to register their employees in the CoWIN portal and create CVCs and vaccinate them within 13th to 15th of May. Beneficiaries above 45 years can book under age-appropriate category. The Health Department said that no further registration will be entertained unless decided by the state. The Nagaland government has introduced a state health helpline number 1800-345-0019 for citizens to inquire about COVID-19 related issues. Any person can call the helpline number and consult with a doctor or a counsellor for COVID-19 vaccine inquiry or symptoms or on mental health issues. The doctor and counsellor will be available from 7 a.m. to 9 p.m. Kohima District Administration has designated 6033833879 and 9362705742 as designated helpline numbers of the Kohima District Task Force. Deputy Commissioner Kohima informed that the numbers will be available 24/7 to the public to cater to all queries related to COVID-19. As the number of COVID cases is on the rise, we appeal to our listeners to take all the precautions and all those above 18 years of age to get vaccinated without any hesitation. Stay safe and protected by following these 3 simple steps. Wear a face mask, focus on hand and face hygiene, and maintain a distance of 2 yards for social distancing. With that, we come to the end of the morning news. Have a nice day.